Today we will talk a very important disorder in the clinical sides, which is the acute liver failure. And we will discuss the clinical assessment in case of acute liver failure. The cerebral disturbance, which is the hepatic encephalopathy, is the cardinal manifestation of the acute liver failure, starting with the mild, episodic, reduced concentration and alertness, progression to the restlessness and progressive outburst to drowsiness and coma. Cerebral edema may cause increased intracranial pressure, leading to the unequal, abnormally reacting or fixed pupils, hypertensive episodes, bradycardia, hyperventilation, profuse sweating, local or general myoclonus, and sometimes focal fits or decerebrate posturing. Papilledema occurs rarely as a late sign. More general symptoms include weakness, nausea, vomiting, and a right hypochondrial discomfort. On examination of the patient in case of acute liver failure, we can see the jaundice, which develops rapidly and is usually deep in subsequently fatal cases. However, jaundice is absent in Rye syndrome, and death occasionally occurs in the permanent acute liver failure before jaundice develops. Hepatomegaly is unusual in this case. If found with with a sudden onset ascites, it suggests venous outflow obstruction, which is known as the Budd-Chiari syndrome. Splenomegaly is uncommon and never prominent. Ascites and edema are the late developments and may be a consequence of the fluid therapy. So this was all about the clinical assessment in case of acute liver failure.